Today I want to talk about something very important, and that is a condition known as ankylosing spondylitis. Some patients come to me and they bring this condition saying, I've heard that you can cure ankylosing spondylitis, that chiropractic can cure ankylosing spondylitis. Unfortunately, I have to dispel that rumor because chiropractic does not cure ankylosing spondylitis, and I want to give you a little understanding of what it is and why this cannot happen with chiropractic. Now, with chiropractic, we do the joints of the spine, and we make sure that when the joints of the spine move, that we can take the pressure off the nerve endings and create some relief with the spine. Now, this is very important for the simple reason that the joints or the spinal vertebrae have to be able to move. Okay? Once they move, we can move the vertebra back into position so that there's less pressure on the spinal nerves and the person or the patient gets relief. Now, with ankylosing spondylitis, this is a genetic disease. It's progressive, meaning it gets worse over time. Usually it begins in late teens, early 20s or mid 20s, and it can progress on and on until old age. You can live a long life with ankylosing spondylitis, but your whole spine becomes solid. In other words, the ligaments become calcified, and it becomes almost impossible, if not impossible, for the spinal segments themselves to move. At a certain point with ankylosing spondylitis, there is no movement at the spine at all. It's almost like encasing the spine into a metal pipe. Okay? I want to tell you the truth about this because a lot of patients come to us expecting a cure. With chiropractic, we rely on the vertebra being able to move. With ankylosing spondylitis, the vertebrae do not move at all in the more progressed stages. Now, what we can do at Dr. Spine is provide some relief. For example, if you come in and you have ankylosing spondylitis and you have pain in the spine, we can do some limited therapy. For example, we may be able to do ultrasound. We may be able to do transcutaneous nerve stimulation, or TENS. We can also do massage. We can do muscle work to reduce the stress on the muscles and the ligaments, things like that. But as far as curing ankylosing spondylitis, if any doctor or any clinic tells you that they can cure this condition, they're lying to you, because this cannot be cured long term. Now, some people define cure as just feeling better. If that's the case, cure is the wrong word. In the U.S., we use cure to mean that there's a certain amount of relief for a certain length of time. Okay? With ankylosing spondylitis, because it's a progressive disease, there is no cure. We have not found the cure for it. That doesn't mean that there is no cure, but the study of genetics would have to reveal the secret to ankylosing spondylitis. So far, that has not happened. So I don't want to get your hopes up in saying that at Dr. Spine we cure ankylosing spondylitis, because it's just not true. Now, what we can do at Dr. Spine is provide you some relief, and let me just show you some of the things that we can do for you. Okay? At Dr. Spine, we use ultrasound, we use transcutaneous nerve stimulator, heat and cold therapy, and other forms of therapy to be able to reduce the pain and the swelling with ankylosing spondylitis. Again, this will not cure the ankylosing spondylitis, but will go a long way towards taking away the pain and the swelling and the inflammation.